Coronavirus now, California's positivity rate continues to drop. It's now down to 8.8%. That's nearly a 5% drop over the past 7 days. And we're exactly 1 week out from the state lifting the indoor mask mandate. So joining us live to talk about that is Dr. John Schwartzberg. He's an infectious disease expert at UC Berkeley. And doctor, we're still waiting to hear if Bay Area counties will also loosen their masking restrictions on February 15th. So do you feel like we're ready to actually ditch those masks indoors?
Well, we're close. I think we're probably about 2-3 weeks away from when I would feel more comfortable. But, you know, we're just talking about days, not months.
And California is still weighing in when to lift mask mandates for schools. A handful of states are already making that move. So when do you see that happening? And what do you think needs to happen for us to get to that point where it's safe?
Sure. I mean, we certainly want our kids in school, and we certainly want our kids safe. And to assure that, we need to have the numbers a lot further down than they are now. We need to have the kids still wearing masks until those numbers are down further. But again, I think we're fairly close to that. I think we should reevaluate that question very early in March, and maybe sometime in March we could consider having the kids take their masks off. It's going to be a process, and I know people are very anxious about getting their masks off, not just for kids in schools, but for all other venues. And they look at the numbers and they see the numbers coming down, and it looks really great, and it is great. But remember, the numbers are still higher now than they were just even at the time of Delta, when Delta was still very significant. So we're still in the midst of an Omicron surge. It's just coming down. So I think let's hurry very slowly in this process of taking masks off, both at work and at school.
So are you optimistic for those students by the end of the school year, or are we going to have to wait till next school year?
Well, I'm optimistic that I think some districts will be allowing kids to get their masks off sooner than others. But I'm optimistic for sometime this spring, maybe before the end of the school year, certainly.
And all this easing of the rules is part of a moving from a pandemic to an endemic phase. So can you explain what exactly that means, and what can we expect living with COVID, and what is that going to look like for us?
Yeah, that's a really important question. So endemic means that it's in the community at a fairly stable level. So it's a stable level of disease in a defined geographic area, let's say the Bay Area, California, the United States. Right now, we're not in an endemic stage of this disease because we're seeing these spikes and then coming down again. And that's been the pattern since the very beginning. The hope is that we'll get to an endemic state of disease. But when we get to an endemic state of disease, we have to ask, what level of disease? Endemicity could mean that we're having an awful lot of disease, but it's stable. Or it could mean a very low level of disease that's stable. The latter is what we want. And that's what we have to aim for. And the way to get there, of course, is with vaccination. Get more and more people vaccinated. And for those people who are candidates, get them boosted as well. That's going to allow us to not have these surges, this roller coaster ride that we keep going through. So I'm optimistic that if we can get more people vaccinated, and we're going to have more people immune from those people who got infected with Omicron, and they have some immunity from that now. So we're going to be in better shape going into the spring than we've been since the beginning of the pandemic. Further, we're going to have drugs available, much more available than they are now, both the monoclonal antibodies, Sotrovimab, also Paxlovid and Molnupiravir are going to be more plentiful by late spring than they are right now. That's going to help a lot. We're going to have more testing available by late spring. So when we put all these things together, more immunity, more people vaccinated with boosting, more diagnostics available, more therapeutics available, I think we have the tools to handle this virus much better than we have in the past. So let's look forward to, and I think it's realistic to look forward to, a much better later spring and summer.
All right. Well, thank you very much, Dr. Schwartzberg. Always some good information from you.